back to Edu Skills, OET made easy. Our mission is to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing channel, give us a thumbs up if you like our work, and share this video to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. All these services at Edu Skills are free of cost. Okay, keep smiling. And today we are looking into beautiful reading part C. Okay, shall we begin?
Yes.
Yes, Father.
Yes, Father.
Okay, this is the 5th paragraph. And you can see diagnosis and drugs, drug companies. Again, gist, you have to understand the gist. And until seldom diagnosed disorder. Seldom. You see the scale. Seldom means rarely. So often, always. So you see a scale expression there. Seldom diagnosed disorder. That is the topic sentence of the paragraph that speaks about the paragraph. And nowadays, however, it's common in mainstream medicine in the USA, a paradigm shift apparently driven by 2 factors. They are saying now these days, the modern trends are driven by 2 factors. See, I have striked out these things which are not essential. See, many say less stringent diagnostic criteria introduced by the APA in 2019. All these are secondary informations. And marketing by, see, driven by 2 factors. Rework and marketing by manufacturers of ADHD medications. Some have suggested that this, again, suggestion that this new broader definition of ADHD was fueled to broaden the market of medication. Fueled to broaden the market of medication. In many instances, the evidence preferred to expand the definitions came from studies funded in whole or part by the manufacturers. The company people, manufacturers are funding the studies, and clinicians involved in diagnosing ADHD were receiving money from the drug makers or companies, drug companies. So corruption. So you can see how they influence. That's not essential here, but I'm just driving you through the, hope that is clear. And coming to the next question. Yes, somebody.
In the 5th paragraph, it is suggested that drug companies have been overly aggressive in their marketing of ADHD medication, influenced research that led to the reworking of ADHD diagnostic criteria, attempted to change the rules about incentives for doctors who diagnose ADHD, encouraged the APA to rush through changes to the criteria for diagnosing ADHD.
See? Seldom diagnosed until this century, adult ADHD was a seldom diagnosed disorder. Nowadays, however, now there's a contrast coming. Nowadays, however, it's a common in mainstream medicine in the USA, a paradigm shift apparently driven by 2 factors. All those things they are saying, then they are saying how it was fueled to broaden the market for medication. In many instances, the evidence proffered to expand the definitions came from studies funded in whole or part by manufacturers. This all things say the manufacturers who are controlling the diagnosis aspect of ADHD. They fueled or they controlled, they funded partially or wholly the research work or studies on ADHD. And as a criteria, they also clinicians involved in diagnosing ADHD receiving money from drug makers. There are also reports that the corruption was happening. Clinicians were getting money and they were diagnosing many people having ADHD so that the market could be fueled or encouraged. So you'll see this comparison here. Okay, influence research that led to the reworking of ADHD. The synonymous language used for influenced is fuel and involved in getting money and funded by the manufacturers. All these are influences, giving funds for studies on ADHD and also bribing them, bribing clinicians and fueling the or encouraging the diagnosis of ADHD, all by drug mafia or marketeers is important. So the only this particular thing is true here. First option being overly aggressive in their marketing or ADHD medication. They are not, the whole paragraph doesn't speak about any aggressive marketing strategies of particular drug company. It doesn't speak drug companies, how do they market or their aggressive way of marketing. It doesn't speak anything. It only speaks how they influence the medical professionals. Third option is attempted to change the rules about incentives for doctors who diagnose ADHD. There is nothing about rules about incentives. The whole paragraph doesn't speak anything about rules about incentives for doctors. It speaks only they were bribing clinicians or doctors or health professionals. Fourth one, encourage the APA to rush through changes to the criteria for diagnosis. Nothing is mentioned about they influencing APA. They are speaking about influencing the clinicians or the health professionals. So that also can be eliminated. Now, 6, addictive nature of ADHD. Paragraph speaks about after effects of medication, that is addiction. See the beautiful topic sentence. This brings us to the issue of the addictive nature of ADHD medication. So the whole paragraph speaks about this particular. That was the glance about the text, whole text. That is the best clue for your understanding and identifying the answers. And I'll show you how can it be done. Medication, and at the end, they conclude, say that, so more work needs to be done before we can settle the questions surrounding the diagnosis and treatment of ADHD. More work needs to be done. Means we have to do more. Whatever is done is not sufficient. That's not enough. So what I wanted to show you is here, this sequence, what you call coherence and cohesion in the assessment criteria. On the test, you can use that particular approach where you need to understand the sequence. And yeah, next.
In the final paragraph, the word trademark refers to A, physiological reaction, A, substitute medication, C, a need for research, D, a common request.
The trademark, what does it mean? This is because the body stops producing the appropriate levels of neurotransmitters that ADHD drugs replace. A trademark of addictive substances. This is body means physiological, stops producing the appropriate levels of neurotransmitters that ADHD drugs replace. A trademark means this particular aspect is the trademark. Let's check. See, in the final paragraph, the word trademark refers to, you can easily make a physiological reaction. This is because the word body stops producing. What is the physiology? Body means physics. Physiology is synonymous used for body. So this hyphen, a trademark, means this is the trademark. So again, this is a lexical question. That's what I said. You have 2 lexical questions. Clearly speaking, the answer is just before that particular question. And the last one.
In the final paragraph, what does the writer imply about addiction to ADHD medication? It is unlikely to turn into a problem on the scale of that caused by opioid abuse. Second one, the effects are more marked in certain sectors of the population. Insufficient attention seems to have been paid to it. The reasons for it are not yet fully understood.
Yes. See, at the end of it, actually, it says more work needs to be done before we can settle the questions surrounding the diagnosis and treatment. Let's compare it. Here you can see in the final paragraph, what does the writer imply about addiction to ADHD medication? It is unlikely to turn into a problem on the scale of that caused by opioid abuse. It doesn't speak about opioid abuse at all. The effects are more marked in certain sectors of the population. They don't speak anything about different sectors of population in the whole paragraph. And the reasons for it are not yet fully understood. They are not speaking about reasons are not fully understood, but insufficient attention seems to have been paid to it. So more work needs to be done. That is a paraphrasing of insufficient attention seems to have been paid to it. We have done some work, but you need to do more work. We say you have done some practice, you have been doing practice, but then you need to do more consistent practice to get a good score in OET. So more work needs to be done before we can settle the questions surrounding diagnosis and treatment of ADHD. Insufficient attention seems to have been paid to it. So they are putting in a paraphrased way, insufficient attention is paid, means we need to pay more attention. Here it says more work needs or more attention needs to be paid, or here it says work needs to be done. So that's a paraphrasing effect being used in this. And that is it.